Thanks very much, Rita. Finally, let me welcome Anne Milton MP, who's the UK's Parliamentary Under-Secretary of State for Public Health, and, as it happens, my local MP. Anne's ministerial responsibilities include nutrition, children's health and professional regulation. She's also a trained nurse with 25 years' experience in the UK's National Health Service. Anne's going to briefly offer her perspective on how health and wellness issues are impacting on the retail sector. Ladies and gentlemen, Anne Milton.
Thank you very much. And the story of how I started life for 25 years working in one of the most highly respected professions and ended up in what is possibly now one of the least respected professions is a story for another time, I think. Just to say, I want to start by saying a thank you for those around this room who we are already working with in government. And listening to the previous speaker talking about brands, actually all brands I want to be about health and well-being, because we do have a problem. In the UK, 60% of adults are either overweight or obese. If you look at the rates of alcohol-related liver disease, they are really staggering. Despite all our best efforts in the UK, over 20% of adults still continue to smoke. And despite the clear health benefits of physical exercise, not enough of us do that critical 150 minutes a week. And improving the health and wellness of the nation is all our business. It's not just about the benefit to individuals of living longer and healthier lives. It's also a very key factor in economic growth. An improved workforce, an improved health workforce will help boost productivity and economic growth. The Public Health Responsibility Deal, which we have started in government, is a voluntary partnership between government, industry and the wider stakeholders, links improved workforce and public health with improved productivity and economic success. It is, if you like, a way of doing things differently. It is an ambitious and far-reaching challenge to business and others to lead the way in positively shaping and creating healthier environments, one that helps people make choices, healthier choices that are better for their lives. It's almost 18 months now since the responsibility deal was launched, putting sectors of industry, health, consumer bodies and government around the table has meant much more progress, much more quickly. And I have to say, in the light of a very cynical press. So I want to particularly, again, reiterate my thanks to all those businesses, including those here today, who have made the responsibility such a success. And turning around the cynicism of the press, I think, is the one thing that we have now achieved. We have now over 400 responsibility deal partners, more than double the number we started with just over a year ago. And it is a case of being volunteers. It's not about enlistment. Companies recognizing that improving public health is everybody's business and that the best interests of customers are also the long-term best interests of business. And that the retail industry has the information, innovation and enterprise to really improve the health of their customers. And the results are very clear. The virtual elimination of artificial trans fats, a world-leading program for salt reduction, 8,000 high street takeaways and restaurants now displaying calorific information on their boards. More recently, a pledge to take 5 billion calories out of our diet, and over 3/4 of supermarket retailers have signed up, with others waiting in the wings. Just the beginning of what must be a bigger and broader effort by the food industry. And also supporting our alcohol strategy. 34 major alcohol companies have said that they will remove a total of 1 billion units from the market by 2015. more low alcohol drinks, smaller measures, reductions in the strength of existing partnerships, products. And as I say, this is voluntary. This isn't enlisted, this isn't coerced, this isn't an arm behind your back, maybe a little bit of an arm behind your back at times. But actually this is being done in a collaborative way. Over 80% of all alcoholic drinks on the shelf will have clear labelling on units, NHS guidelines and pregnancy messages by the end of next year. We have also developed pledges to help and support both employers and employees to manage conditions such as diabetes, cancers and heart disease in the workplace. Some of the businesses that I have visited, really quite moving stories, how small businesses in particular have turned round their companies, improved productivity, reduced sickness benefits by managing the health and well-being of their workforce. There are some who stand on the sidelines and won't play on the pitch, who claim easy regulatory solutions exist where they do not, and we have set the most challenging public health objectives of any country, and with the creative, proactive participation of industry. But we are not complacent despite the success to date. We know there's a lot further way to go. We recently announced the first tranche of catering companies who have pledged to reduce salt in their products. In the next months, we will announce those early signatories who've pledged to increase people's consumption of fruit and vegetables. Two things that are not easy. If I think of the catering companies, taking salt out is not an easy thing to do. But the responsibility deal shows what can be achieved for individual people and their families when government works together with the industry. On top of that, Change for Life continues as a way to share some of the work that you are doing with customers and offers a positive and appealing approach to changing behaviour. Our success so far shows that it can, and in practice does work. I'd encourage all of you in this room to act as ambassadors for the responsibility deal, and we are looking to broaden and deepen its reach. I hope all of you present will help us achieve greater sign-up. We do have a very cynical press who demonise both government and the industry, and we have to prove them wrong. What I do know is that we have started, if you like, a wave of enthusiasm and support for this, as we're seeing companies both small and large see the benefits for their company, and also actually to give them a good feeling about what they do. We have a problem, and if you look at the figures worldwide on non-communicable diseases, it is a growing problem. We have to turn that round. I know, as many of you do will in this room, that legislation and the legislative route is not only slow and cumbersome, but also ends up with unintended consequences. We have to create brands that are about health and well-being, about improving the health and well-being of our population, about improving the health and well-being of our workforce, and critically for the government in this country, about actually reducing those really shocking inequalities in health that exist. Thank you all very much.